Good morning and welcome to Ask Dr. Murphy, This Week in Public Health. I hope everyone is doing well today. My name is Katie Berg. I'm a research study coordinator with the Havey Institute, and I'd like to welcome and introduce this morning Dr. Robert Murphy. How are you, Dr. Murphy?
Doing quite well, thank you.
Dr. Robert Murphy is the executive director of the Havey Institute for Global Health and the John Philip Fair Professor of Infectious Diseases here at Northwestern's Feinberg School of Medicine. Today, Dr. Murphy will be addressing the latest headlines and answering a viewer submitted question through today, March 20th. Happy spring. We welcome any questions or comments down below or at any of our social media, including Dr. Murphy's new Substack, where you can get the breakdown of these stories we discuss today. But starting today with a huge story out of the UK, a meningitis outbreak has affected close to 20 people or 20 people. Dr. Murphy, can you tell us about it?
Yeah, this is a an outbreak at the University of Kent in the United Kingdom in England. And it's linked to a nightclub that's very popular with students. And like you said, there's at least 20 cases and that have been confirmed. Um, and the two of them have died. So a 20-year-old student and an 18-year-old high school student have died. There's also a French international visitor who was there who's also ill, but they're in France now, I think, and they don't know the status of that person. So anyhow, so this is meningococcal disease. It's a bacteria. There's a vaccine to prevent this. And interestingly, in 2015, when the meningococcal B vaccine was offered to all babies in the United Kingdom, that would protect them. But college students would have been born before 2015. So they're at risk. And they didn't offer to vaccinate older people. And so this is what happens. And it can be a very devastating disease, very easily transmitted in close quarters, military barracks, universities, nightclubs, and about 5% of people die from it. It's a potentially lethal and very devastating disease. Even the ones that don't die, many of them can have severe long-term complications.
Mhm. Very, very serious. We will keep following this story as long as there is reporting.
Hmm.
And sticking with that vaccine topic, huge news early this week in the US with a judge striking down some of the decisions made by the Department of Health and Human Services here. Can you tell us about those decisions?
Well, what happened is the judge, a federal judge in Boston, has blocked the change that the Department of Health and Human Services and the Advisory Committee for Immune Practices, or ACIP. That's the committee that was disbanded. All the experts were kicked out, and they put all these anti-vaccine people in there. And they wanted to restrict access to many vaccines, and they were following the example in Denmark, which has nothing to do with the United States or the population here, which is quite larger than Denmark, which has a population of about 5 million, which is about the size of Wisconsin. And uh, and basically every professional authority has come out against this. And the judge said, okay, hey, let's slow down. We're going to stop this decision. These people are not acting in the best interest of the nation. And most likely it will be appealed. We'll see what happens on appeal. But that's where we stand today. So at least we're going in the right direction in terms of the public health.
Mhm. So that is good news. And some news that's not as great is that this year's flu vaccine doesn't seem to have been as strong as we would have liked. Can you bring us that data?
Yeah, the whole thing about making the different flu vaccine every year is based on what's circulating in the southern hemisphere the half a year before. The seasons are flipped. So the respiratory season in the southern hemisphere is where we think is going to come to the northern hemisphere during the respiratory season, disease season. And this, what they selected to make the vaccine is only 25 to 30% effective. Usually it's like 40% or 50% effective. That doesn't mean you don't take it. It'll still have a massive impact on the population. But this was this was pretty underwhelming, the response here. And it's partially what's going on. This particular flu season was quite severe because of the dominant strain, H3N2, which had more severe illness. There have been at least 27 million flu cases, 350,000 hospitalizations, and 22,000 deaths, including 101 pediatric deaths. So, flu is devastating. And unfortunately, the vaccine didn't work as well. Now, what will happen because the technology to make the vaccines is changing? It's improving, and we reported just in the last couple of weeks that, for instance, Moderna has a flu vaccine that was studied in 40,000 people. It worked as good, if not better, and they can make it much faster than the old-fashioned way of making the vaccine. So if something changes in that circulating flu from the southern hemisphere, they can adjust the vaccine much quicker. It's much more nimble. So stuff like that and better vaccines will help.
And on that very note, we have a submitted question this week from a longtime viewer asking if there's any news on COVID vaccines for this upcoming 26 to 27 respiratory season.
So like the flu vaccine, we expect formulations to change. And the most of the COVID vaccines are mRNA technology, which can be done kind of at the last minute, much more nimble. And we expect that before the next flu season and respiratory infection season with COVID and RSV, that they will select the type of strains that are circulating later in the year to make that vaccine, so it'll work better.
Mhm. So we will keep up to date on any and all big meetings that help decide on which strains to target. But some other great vaccine news here in the US is that the RSV vaccine has been expanded in its approval for use. Can you tell us about the group that's now eligible?
Yeah, so this is another move in the right direction. So the FDA has allowed the use of the RSV vaccine for any adult 18 and over who's at increased risk. And that's not a small number of people. That could be as many as 21 million more adults under 50 have at least one risk factor, which would make them eligible. RSV, if you're at risk for RSV, so under 2 years of age or 1 year of age, and then over 75 or over 60 or over 50 if you have some underlying disease. It's a very bad disease. In the US, it's estimated there's 21 million adults, like I said, are under 50 at risk, and there's at least 17,000 hospitalizations, nearly 2 million outpatient visits annually, and somewhere around 10,000 deaths per year from RSV. So it's a very serious disease, and it's a preventable disease now because of there's these vaccines that are out there. So this is good news too for public health.
Mhm. Very good news. And again, not so good news is that we continue to see more measles cases here in the US. We couldn't get the full update last week, so can you bring us the fresh numbers this week?
Yeah, so overall, there have been 1,487 confirmed measles cases this year, an increase of 125 from last week, primarily people that are unvaccinated. 74 of them have been hospitalized recently. And it's not going to go away. Measles is so contagious that if you don't have 93 to 95% vaccine coverage, it's going to get everybody who's unvaccinated. So you have to have a really high level of vaccination. In the year 2000, we had no measles cases in the United States. Measles can be deadly. Some 3 in 1,000 or so can actually die from it. We've had 3 deaths in the United States during this outbreak. And people can be very sick, end up in the hospital. It's all totally unnecessary. And this vaccine's been around forever.
Mhm. Now, our final story today is a quick heads up about a possible E. coli outbreak that has sickened people across a couple of states. Can you give us the details?
Yeah, this is an unfortunate uh, E. coli toxin producing E. coli outbreak that's linked to a unpasteurized or raw cheddar cheese from a place called Raw Farm in Fresno, California. There have been 7 cases confirmed in California, Texas, and Florida, 4 of them in kids under 3 years of age. 2 ended up in the hospital. You can get very sick. You can even die from this. And the cases are all linked. They're linked to this cheddar cheese. They went to this place and did all the cultures there. They did not find it. That doesn't mean it didn't come from there. But so there's a link to that product with the 7 people. Um, but since they didn't find it in the raw farm products that they examined, the CDC is advising consumers who have the cheese at home to consider not eating it. I would think that it should be a little firmer, but uh, it is what it is, and if you have that cheese around, you should really get rid of it.
Mhm. Definitely consider getting rid of it.
Consider, strongly consider.
But on that note, I'd like to thank you, Dr. Murphy. Thank you for bringing all of these stories to our attention and helping us understand all the important details.
Well, great, Katie. Thank you very much for all your help.
Thank you. And thank you all for joining us for Ask Dr. Murphy this week in public health. We hope to see you back next week. And of course, feel free to leave any questions or comments down below or at any of our social media. Have a lovely weekend.